In today's video, we're going to discuss one of the most important topics which are going to be there in your medicine stations, which is tiredness. Now, it's not very tricky to tackle, but we have some tips and tricks that we can use in order to make sure that you're able to ace the station. So, you're going to have a couple of stations, and they will include anemia, obstructive sleep apnea, cancer, chronic fatigue syndrome, tiredness due to drugs, depression, fibromyalgia, hypothyroidism, hyperparathyroidism, and scenario from tuberculosis. So, today we're going to discuss the approach of a station regarding tiredness. So, first of all, you're going to start your station with greeting, which is you need to complete grips, which is greet the patient, give out your introduction, ask for the patient's introduction, develop a rapport, and then ask the patient how you may help the patient. Or in case if it is a follow up scenario, then all you need to do is you need to paraphrase all the information that you've already been given in the question which is given to you outside the cubicle. So moving on, the second step that you need to follow is exploring the presenting complaint. Now, this is one of the important things when when it comes down to scoring well in your data gathering. So when you need to explore the symptom tiredness. So start off with a question, what do you mean by the tiredness? Okay, and then explore about the para. Okay, so of how often do you feel tired, and is it sudden or is it gradual? When did it exactly start? How is it progressing? Is it getting better or is it getting worse? And does your tiredness improve with resting, or does it improve with sleeping, or anything else that you do with which helps you feel better? And then is have you had any illness before you had the onset of these symptoms? Did anything specific happen when you started feeling this way? So, and apart from this, is there any other symptom that you are experiencing at the moment? Then, once you're done exploring the particular symptom that you have been given, which is tiredness, now you need to dive into the DDs, which are the differentials. So, there are a couple of DDs that you may keep in mind when exploring tiredness. In almost all the stations that you come across regarding this typical symptom, you're going to ask questions regarding anemia, apnea, cancer, chronic fatigue syndrome, depression, and hypothyroidism. So, how are you going to rule these out? So, for anemia, you can ask a few questions regarding, do you feel like your heart is racing? Um, do you have trouble carrying out daily life activity tasks? Then regarding apnea, you can ask if you're able to fall asleep comfortably at night. Do you wake up at night to gasp for air? Do you tend to sleep during in the middle of the day, or do you take naps in the middle of the day? Then ask about cancer. In order to rule out cancer, there is a specific mnemonic that you need to follow, which is flaws. So ask about fever. So do you have any fever? Do you have any loss of appetite? Do you have you lost any weight recently? And do you feel like you sweat a lot, or is there any sweating, any changes at all regarding that? So that will rule out any cancer, any chances of cancer, or any chances of infections. Moreover, you need to how will you rule out chronic fatigue syndrome? Just by assessing the fact that is it a long term symptom, which means is it a chronic symptom, or is it an acute onset? So, if the patient says that the patient has been experiencing this certain symptom for the past 6 months or 5 months, that and there are no other factors that have been contributing to it, then most probably it's going to be chronic fatigue syndrome. Moving on, another differential that is important when you're exploring tiredness is depression. So, for depression, the questions that you can ask are how is your appetite? How is your sleep? How is your mood throughout the day? So, can you score your mood for me on a scale of 1 to 10, 1 being the lowest and 10 being the highest? Um, are you able to carry out your daily life activities as comfortably as you used to? And have you do you still feel interested in things that you used to enjoy? So such questions are going to rule out depression. Then you can ask 2 to 3 questions regarding hypothyroidism, which is okay, so have you gained any weight? Are there any changes in your bowel? Are there any, if it's a female, ask about menstrual cycle. Are there any changes in your menstrual cycle at all? Do you happen to feel cold when others are comfortable at a specific temperature? Okay, so moving on from DDs. Now we're going to discuss what you will be discussing after the differentials. So once you have explored all the differentials, now you need to ask about the psychosocial effect of the symptom. So how has the symptom affected your life? Has it affected your work? Has it affected your life at home in any way? Has it affected your relationships? um, then again, now you have to come down to ice. Okay, so this is something which is going to contribute well to your IPS scores. So ask about the idea. So you can state it in a way that is there anything specific that is there anything specific you think might be causing your symptom, or is there anything particular that is concerning you at the moment? Then, after doing ice, move on to P. Now, miftosa, as discussed earlier, is the medical history of the patient. So, ask about any medical conditions that the patient might be having or might have been diagnosed of. Is there any medication that you're allergic to? Is there any medical condition that runs in your family? What do you do for a living? And ask about smoking and alcohol. So, do you smoke or do you drink alcohol? And how much do you smoke and how much alcohol do you drink if the patient says yes? This will help you to rule out some of the cases, such as if the patient is taking drugs, for example, and the tiredness is caused by a certain drug. Then you'll be able to rule out once you ask the patient if the patient regularly takes any drug, or patient has been diagnosed of depression in the past. So, moving on, once you're done with your history, now you need to summarize everything that the patient told you. You can just take up the basics or take up the important information that you were told by the patient, so that the patient understands that you were listening actively. Moving on, now you need to examine the patient. And by examination, I mean that now you need to take up the observations, which will include blood pressure, pulse rate, oxygen respiratory rate, and temperature. And along with that, you will be doing some specific examinations, such as examining the patient's chest. And along with that, you will be examining the patient's neck to make sure that thyroid isn't the one that is causing the symptom. Now, after you've done your examination, now you have to provide the provisional diagnosis which is needed for the patient, which you need to explain it to the patient. So, when you're explaining your provisional diagnosis, you have to be very your words should be very easy to understand. There shouldn't be a lot of medical jargon which is difficult for the patient to understand. So it could include you have to explain in very easy words what is exactly happening to the patient and why do you think that the patient is diagnosed of a certain disease. So for example, in case of a hypothyroid patient, you can say that so there's a butterfly shaped gland in your neck, which sometimes it starts it so it sometimes stops working, or it gets a bit its activity gets decreased. So there might be quite a lot of reasons for that, so we will be investigating those. So we have some options of how we will manage your condition. So would you like to discuss them? Then move on and start discussing the management. Again, in the management there are 7 steps that you can keep in mind to make sure that uh, you're able to tell everything to the patient. So, first of all, do you need to admit the patient or do you need to refer the patient? Number two, discussing the case with your senior. You have to be very careful when you're involving your senior, because you have to involve your senior in a way that you're not showing the patient that you aren't capable of treating the patient, and at the same time you have to show that you are doing so to ensure safety of the patient. Then you have to do some investigations, which are the basic or blood investigations. The investigations totally depend on the setting which you are in. For example, in GP settings there are a lot of investigations which you cannot carry out, but in the hospital there are investigations that are easy for you to do. So in case if the patient has come to you in a GP clinic, you will carry out the basic blood investigations that you need. And moreover, now you can provide the patient with some symptomatic treatments to make sure that you can improve the quality of life that the patient is having right now before the patient reaches the specialist or reaches the hospital. Moving on, you can set up follow-ups with the patient, and you can offer the patient a leaflet through which he or she can get an understanding of what's going on with him. Lastly, one of the most important things that you need to make sure that you're able to tell the patient about is safety netting. This is extremely important in order to make sure that you're able to pass the station. So always safety net for red flags in any particular case. For example, if the case is regarding depression, you need to a safety net regarding suicide. So that is all for the approach of tiredness. If you have any questions, you can always go ahead and you can email us at plabquest1@gmail.com. Thank you so much for watching.